Ladies and gentlemen, welcome to another insightful episode of MedSynapse podcast series. I'm your host, Dr. Nigar, and today our topic for discussion is navigating the transition to medical residency, which is a pivotal phase in every medical professional's career. We have a special guest who is no stranger to the challenging yet rewarding journey from medical school to residency, Dr. Mohammed Mustafa Ali, a general surgery resident who is here to discuss our topic today. Dr. Mohammed has successfully graduated from Ras Al Khaimah University of Medical and Health Sciences in 2021 and has also practiced as an intern with the Dubai Health Authority before getting matched into residency at Department of Health of Abu Dhabi. Dr. Mohammed also holds a keen interest in research and has published researches in international journals. Apart from that, he has also presented in international conferences in the field of surgery, including the most recent conference, American College of Surgeons UAE chapter, where he presented a unique case report. Welcome, Dr. Mohammed.
Thank you so much, Dr. Nigar, for that very warm welcome. It's a pleasure to be here on this platform to connect with you and all the other professionals and students who are watching us. It would be a very insightful episode.
Thank you so much for joining us on MedSynapse, and I'm very excited for our conversation today. Now, without further delay, let's begin with our podcast. Dr. Mohammed, as someone who has been through the journey from medical school to residency, what advice would you give to new medical residents who are just starting their medical journey?
Okay, that's a wonderful question, Dr. Nigar. Before I actually answer this question, let me just give you a correlation on how to explain the situation. Your medical career that starts as a medical student, advances to medical intern, goes through a medical resident and carry on the career pathway, ends up as a consultant. So every step that you graduate from is a step higher that you go towards more responsibilities. As a medical student, your only responsibility is to know and gather the information around for the patients. As an intern, you're supposed to start applying the information you have learned. As a resident, you're supposed to start taking responsibilities. So the advancement from a student to a resident is the way you have to orient yourself to patient care. You're going to visit the same hospitals, you're going to visit the same clinics, you're going to see the same patients because it's the same environment. The vibe is going to remain the same. The thing that is going to change is your approach. Every student that becomes a resident has gone through a serious years of training to gather all the information they need to survive on the position as a resident. So the first step is to make sure that you are actually satisfied enough with your experience in the past. This bringing me to the first point that I would want to share is do not be overwhelmed. It's a status that you are going to learn through for the next 5 or 4 or 5 or 6 years, depending upon the residency program you matched into. Don't make your first day as your last. Start your day step by step, gradually increase your amount of procedures, skills, and even your patient care interaction. All these small things are going to add up to a bigger outcome in the future. So make sure you're not overwhelmed on day one. You take everything step by step. It's baby steps in the start, and then you're going to leap, and then you're going to start walking, you're going to run, and then you're going to actually overpower the department. So day one, take it slow, do not be overwhelmed, and take each step at once. This is one thing that as residents is very basic to understand because the application of knowledge will come over a period of time. You are not a consultant on day one, but start thinking like one because that's where you will end up in a career now.
Thank you so much for the wonderful and this great tip. And I can imagine how the early days of residency can be quite challenging. Now, could you please share some of the most difficult moments you faced during that period and how did you manage to overcome them?
That's a really good question again, Dr. Nigar, because as a resident, we will face more problems than successes. because this is the phase where you have to learn. So this is the place where you will be actually screwed over. This is the place where you will actually be monitored closely. And this is also the place where you will actually be scrutinized well. So I feel every moment or every step that you go through is a new experience. So these experiences are based upon you, how you take them on yourself. You could be optimistic or pessimistic. You take these as learning steps to become better, you are actually going to go on a positive mindset. The same things if you are going to retrospect as something which is demeaning to you, something that is harnessing your small character that you have created for yourself, this is going to go into a negative way. There are ways to deal with both these sides, the positive and the negative, but again, it depends upon your mindset and how you take it forward. The most challenging thing when I started residency is actually two, because I had to move a bit distant from my family. When I marched into residency, it's a separate place where I actually grew up and stayed at. So being distant from them, however, it was not the first time. I during my training as a medical student, also I had to travel to places which were distant from my family. It was easy for me to cope up in the start, but again, you say that there is a lack of emotional support for you as you go through the new phase of your career. But this can be challenging for a few of them. But I'm really glad, alhamdulillah, that I actually got a grip of the hold on how to get through this process really soon. And it got me comfortable when you have supporting colleagues working around you. Because everyone is in the same boat. So you row the boat together, you stay afloat, and you will stay calm. On the second hand is the working shifts. As a medical student, as an intern, you punch in, you punch out, you go at a time, you are fixed to a schedule, you work within a department. As a resident, you have to go beyond boundaries. For example, there were days when I used to scrub in for a surgery probably at 3 o'clock, and the time my shift ends is 4:30, and surgery finishes up at 6:37. And then I have to actually wait until the patient is properly shifted to post-op, make sure my duties as a resident are fulfilled before I leave the hospital. So challenging your mind that it has to be flexible rather than a fixed time schedule is something that was different than what you experience as a student or an intern. Moreover, you can talk a lot and rant about how your 24-hour on-call shifts also go on. So this is a new step that as a resident you feel, because as I mentioned earlier, responsibilities start pouring in, and this is the place where you have to actually make it count. But again, as a resident, you progress through the years, you know how the system works, you get a hang of it. But as you keep getting hang of it, as you keep going ahead, things will become more seamlessly possible to be done. So I feel it's a gradual increase, and it actually happens over a period of time. So nothing happens in a day, as the famous saying goes, Rome was not built in a day. So as a resident, you will not be able to take over the department in a day. Give it time, give it some steps, give it some work on it, be hardworking, moreover be smart working, and you will get through it.
Now, transitioning from a medical student to a resident is a significant mental shift. Speaking about the mindset, how did you prepare yourself mentally for this transition? Like, what mindset did you find most helpful?
Honestly speaking, if you talk about mindset specifically, there's nothing that can mentally prepare you. You cannot tell someone, oh, there's a torture coming, be prepared. You can never be prepared for something that's going to be an adverse event right in front of you. But what I can tell you, what helped me in a smooth transition is to accept what's there in front as soon as possible rather than rejecting it. It used to happen often, if you remember everyone back as a medical student or a medical intern. If you feel there is something that you do not like or something that you do not want to go ahead, you can always refuse. You can take a step back rather than taking a step front to learn a procedure, to learn a skill to do. But as a resident in that department, you are completely committed to it. So you need to make sure that you go the extra mile. You have to actually be the surgeon's aid. You have to be his mind, you have to be his hand, you have to be his helper, you have to be everything that assists him. So for me in surgery, I have to make sure that I make things seamlessly easy for my professors, for my surgeons, for my senior doctors. So as a whole, it falls in as a responsibility in me to make sure that I do all the scout work properly. So preparing your mindset to accept these things are going to happen, you have to move on with it, is one of the best things that will get you accustomed to the department and the system as soon as possible.
Thank you so much, Dr. Mohammed, for your great insights on mindset. I'm sure it will help a lot of the new beginners out there. Now, moving on to our next question. In the world of medicine, support networks and resources are very much needed. Could you please share which resources or support networks for professional growth during the residency time?
Okay, a very, very good question. And I would actually read this back to your medical school or your medical intern rather than residency itself. Your networking starts with you interacting with people. The first step is you interacting with your colleagues in your class as a medical student. Goes to medical intern, you start interacting with your doctors, your clinical rotations, you start seeing patients, you start interacting with patients. Once you become a resident, you have to elevate your game. You have to start networking with professionals with the same industry and around. Now, what does this mean is the first very easy step to start networking is basically attending your conferences. For example, you are in your pediatrics rotation in medical school. Attend a pediatric conference upcoming. Try to meet the professionals in the conference. Listen to their talks. Try to find out why they are best at what they are presenting. Try to connect with them. Make sure that you're connected on social platforms, which is because we are currently living in a digital age, and this social platforms will connect you seamlessly with just a single touch. So you have to make sure that you make yourself properly prepared on this platform before you advance through a later time and you have found others have already cruised through it. So you have to make sure that you start networking with people as early as possible. You're a medical student, start listening to conferences, start going to journals, start listening to online videos of highly recognized professors who are sharing their insights. Try connecting with them. You have any question, email them, follow up with them and see if they are responding to you. One other thing is you can actually publish international journals. Journals start recognizing you. You start creating a community, starting to meet people among the same community or even from different specialties. You could meet residents from internal medicine, residents from emergency medicine, residents from general surgery, and many others. You can connect because at this age, you are going to work into a diversified environment. And it is all going to happen when you have colleagues from different departments getting connected with each other. You could learn an ED procedure while you teach them how to suture. So there are many procedures that residents can actually benefit with learning with each other. So this is one way to network with people. Try sharing your contacts, try sharing your socials, try going to conferences, try connecting with professionals. This will enhance your portfolio as well as your strength within the community of the residents that you are in.
Now, balancing the demands of residency while maintaining a personal life can be quite challenging. What practical tips can you offer to fellow residents for achieving a healthy work-life balance and preventing burnout while excelling in their roles?
Okay, perfect. A very, very important topic to be talked about, mental peace and mental health, which is again, as a part of the residency programs in this country, which is highly taken care into. You have support clinics, you have support mental groups where you have professionals talking to you, making sure that everything is remaining in a very nice balance among residents in different specialities. But again, this is how a workplace will conduct its own experiments or its own regimes and programs to make sure everyone in the department is fine. But again, let's come back on a personal basis. You have to always make sure that you have a life outside work. There's a very good example. When I joined residency, I was looking for a place to stay, and my program director actually gave us a very good idea, saying that whatever you do not take a place 5 minutes from the hospital. Let it be at least 10 minutes from the hospital. And the reason being that you should not see the hospital right from your window door or from your house door. You shouldn't see the hospital, because if you have that gap between you and the hospital, you're never going to see life outside the hospital. Try to have a drive, maybe 10 minutes. You drive, you see the environment around, you see the vibe around, you see different cars, you see different people, you see markets. You will actually look at on an outlook that will allow you to explore something else other than the hospital when you're outside work. So this was a very good advice that I received, and it was actually really helpful, because as residents, the term itself means residency, which is your second home. You make your hospital as your second home. So you don't want to be living at a place where you see a hospital and then rush back to it because the work demands you. Rather, you have to move to a place where you know the hospital is going to stay. The work is going to happen with you or without you. You will be there when the hospital needs you. But when the hospital doesn't need you, when you're off your schedule, you can plan the way you have your passions, your interests, your hobbies lined up. There was a very beautiful description given by one of my seniors. You have a 24-hour on-call. You might have the worst possible shift. You might be completely drained out. There are two possibilities on a post-call. You go back home early the next day. You can actually crash into bed for 12 hours, or you can crash into bed for 6 hours, get up, be dressed, and go out, enjoy your hobbies, attend the wedding, go out, celebrate, have dinner with friends, with family, and still have a good life. It's just an overview on how you perceive your mind to be. Are you really that tired? Take a rest. Are you not tired? Go out and have your enjoyment the way you plan it, the hobbies you enjoy. This thing will actually allow you to plan your life among yourself. Do not wait until the end of the month, until the end of the rotation to actually take care of your burnout. Try to release with small stress busters throughout the day. Maybe talking to your helpful colleagues around you who try to put a smile on your face at least for 5 minutes throughout the day. These are small stress relievers through the day. And this will add up on a long period of time, which will actually provide less stress to you and also avoid burnouts. If you keep gobbling it up in for a long period of time, probably you're having night shifts for 2 weeks at a stretch, and you're going to wait for 2 weeks to finish so that you can start relaxing. That's not the way it should work. Whenever you get a moment between those days, try to grab it. Probably go for a swim, go to make a new hobby, try to go to gym, or try to play some sports, anything that you like. It shouldn't be that you should do an XYZ thing. You should do something that you like, something that will relieve your stress. This is what is going to help you on a longer run.
Finally, for our listeners who are medical residents or about to start their journey, how can they locate workshops and conferences relevant to their field, especially in the United Arab Emirates, for example?
The best thing starts is by connections. Through LinkedIn, through any social media platforms, through your colleagues. There are many groups that are being created by your friends, by your colleagues, by your seniors in the departments. Just talk about it. Ask people, do you know any conferences coming up? Do you know where is the next surgical suturing class to be held? Do you know when can I learn the next endotracheal intubation skill? Do you know how can I learn where to do a CPR? So asking people or asking professionals in the field that you are rotating with is one best step to know that are any conferences coming up or not. Moreover, try to meet doctors who you're doing research with, try to get it published, try to present it in conferences either as an oral presentation, as an abstract poster presentation, or even as a display presentation. This will allow you to at least meet people, will see your work, people will start connecting with you, and this will open doors for you. Medicine is very interconnected. It's like one door leads to the other, and then it all just opens up. So it's like a web. So you start connecting with one, it opens up doors for all. You can proceed with this way to have a clear mind on where you're actually landing on. So I feel getting connected with people will actually open doors to how you can actually work on getting accepted to go for conferences, to go for workshops, to even go for skills classes. It's all possible. At least in this country, it's very possible because it's a small country with a lot of resources, and you have something going on every other day.
Thank you so much, Dr. Mohammed, for sharing your insights and experiences on navigating the transition to medical residency. I'm sure your journey is very inspiring to all of us, and I'm very sure that your advice is very valuable to medical residents and to aspiring doctors alike. Thank you so much for joining us today.
Thank you so much, Dr. Nigar. Once again, it was a pleasure to be here. I hope this video reaches out to more and more people, which will benefit them. And I hope that there are many other healthcare professionals that come onto the same platform and spread awareness. It's a really, really nice platform to be. And medical healthcare professionals working with each other is something that's going to advance this community.
Definitely, Dr. Mohammed. And we're looking forward to many more podcasts together on such interesting topics.
Definitely.
And to our listeners, if you found this discussion as informative and insightful as I did, make sure to subscribe to MedSynapse podcast series. By subscribing and registering on our website, you will stay updated with more exciting videos and discussions which can be very instrumental in your medical career. We will continue to bring you the latest insights, experiences, and expertise from medical professionals. So don't miss out on the opportunity to learn and grow in your medical journey. Thank you so much for tuning in, and until next time, goodbye and take care.